2.
Hello, my name is Emily Palmer. I'm a junior student here at the Kingsport campus. I am doing my research paper on Pushing Through Addison's, that's the title, and it is about pregnancy in women who have Addison's disease. So I'll start with a little introduction. Before I can actually tell you and explain about pregnancy, I want you to understand what Addison's disease actually is and what's happening in the body as this occurs in women. So what actually it is it's a malfunction of the adrenal gland. What happens is the adrenal gland hypofunctions and it doesn't produce enough of the two hormones that are secreted by the adrenal gland. So you got cortisol and aldosterone. These are the two main hormones that come from the adrenal gland. So what we've got is cortisol decreases inflammation in the body, and it's a very important hormone to have. And then you have aldosterone, which just balances out all the fluid in your body. So with aldosterone, if it's hypofunctioning from the adrenal gland, you're going to have decreased sodium in your body, you're going to have decreased water in your body, and your potassium is going to go through the roof. So we've got to maintain a balance of these two. So what we're going to do, the only option really for Addison's disease, is to put them on a hormone replacement therapy. So that's what I'll be talking about a little bit just throughout the presentation. Here are some of the symptoms that occur in Addison's disease. You got the bronze pigmentation of the skin. As you can tell, she's darker in skin color, and that happens with the low cortisol. That's one of the symptoms of that. You got hypoglycemia, and with the low cortisol, that's what happens with that as well. And that leads to, obviously, diabetes, and you have to check your blood sugars all the time. And with the postural hypertension, that's called orthostatic hypotension. She's got her little blood pressure cuff on there. With the sodium and the water decreasing in the body, you're going to have less water in your body, so you're going to have a lower blood pressure. And when they stand up, they can get syncope and they can lose consciousness. So we really need to monitor that. Weight loss is going to occur with this. GI disturbances, both constipation and diarrhea are in this disease. And just general weakness. That's a very big part of Addison's disease. So those are kind of all broad term symptoms, but really we have to monitor lab work to really understand this disease. This adrenal paralysis is in very serious cases, and this can occur sometimes in pregnancy, mostly in the labor and delivery part. That's why I'll talk about it later. It's a very, very important thing to monitor. We do not want the potassium to raise high at all. We have to monitor that very closely. So this is my thesis statement. This is what I'm going to prove and talk about during the presentation, and I'll read it to you. From implantation to childbirth, the effects of Addison's disease have not been shown to increase the risk of pregnancy for mother or child, regardless of hormone replacement therapy. That's just simply stating, I don't think it's going to cause a difference at all. I've came up with a lot of research on this. So here's my first main point. When you go to the doctor and you get diagnosed with Addison's disease, they're going to start you on hormone replacement therapy. That's the first thing they do. That is one of the only treatments for this disease. In lower cases, in cases that aren't so serious, they can do dietary supplementation that can help you, just like protein 3 times a day and like Gatorade that can increase your serum electrolytes. It's very important. But the hormone replacement therapy is the main thing they're going to start you on. So one of the main problems with this is we're very concerned that, some doctors were concerned that the doses of hormone replacement therapy that are given to mothers with Addison's disease can potentially hurt the baby. That was one of the criticisms for hormone replacement therapy in the child. As soon as a woman finds out she's pregnant, she needs to go see her doctor. She needs to go see her endocrinologist. And they can set you up with just a different dose. They can monitor it more closely, and they will if they find out you're pregnant. They're going to monitor way closer, and they're going to change possibly your hormones and put it on a different regimen. But as long as that patient adheres exactly to the therapy, it will help her a lot. Only 88% of hormones given to these patients actually cross the placenta barrier. So even the ones that do cross, they aren't shown to actually ever really hurt the baby. There's been no studies that have proven this. Stress is another main concern with this, because if you are completely healthy and you're having a baby, your stress levels are going to rise, and that causes cortisol to be increased in the body, increased cortisol. And obviously, a pregnant woman can't do this. She can't produce more because she already has hypofunction. So you just have to go to the doctor a lot. You get your labs drawn a lot, and just monitor it, possibly even every day, depending on how bad your disease is. But it can be done. In labor and delivery with Addison's disease patients, the doctor strongly suggests a C-section. This is simply because when you're in labor, they want to have an IV of cortisol flowing. They want you to have hormones in your body infusing continuously with an IV. So this is very important. Potentially, the Addisonian crisis could occur, and that was with the symptoms earlier that I described. Those are very serious, and we don't want that to happen in pregnancy. And after surgery, slowly, they're going to taper off these hormones, and you'll be back on the exact same regimen that you were before the pregnancy occurred. So you will go back down to the very minimum. Anyway, but all this is proved. There are so many studies out there that prove it is absolutely fine to have a pregnancy if you have Addison's disease. There are no health consequences. There are problems that can occur, but if you have it monitored day to day and weekly, you will be absolutely fine. So my conclusion is, with proper monitoring and interventions, the patient with Addison's disease is fully capable of having an ordinary pregnancy and a live birth. And those are my